Great. So today our topic is anxiety, and we're going to talk about both all the different, contributing factors to anxiety, sort of like what are underlying causes of anxiety, but also we're going to talk a little bit about things that we can do from a natural medicine perspective to treat anxiety. So the first thing I really wanted to start with was to really go through, how do we diagnose anxiety? Like, what is anxiety? Because it presents so differently for so many people. And I'm just going to read you, this is the sort of like generally, backed by research sort of way of measuring anxiety. It's called the Beck Anxiety Inventory. So it's a questionnaire that we do sometimes, especially when it's sort of when we want to be tracking like the efficacy of a medication and things like that. I don't use this as much as some providers do, just because a lot of times I'm really looking for functional changes, like, hey, how do you feel about going to a party? Or, how do you feel about, doing different things that used to be a little bit difficult to do, or a lot difficult to do, or impossible to do. So I'm going to run through sort of what we look at when we're looking at sort of this anxiety inventory. And some things to note are how many of these symptoms are actually physical symptoms. So the way this works is that people are given this, and then they kind of like check off how often this is happening or how much it bothers them. So I'm just going to read all the different symptoms. So numbness and tingling, feeling hot, wobbliness in legs, unable to relax, fear of worst happening, dizziness or lightheadedness, heart pounding or racing, unsteady, terrified or afraid, nervous, feeling of choking, hands trembling, shaky or unsteady, fear of losing control, difficulty in breathing, fear of dying, scared, indigestion, faint or lightheaded, face flushed, or hot, cold sweats. So when you hear that whole list, you can really think about, how many of those are really very much physical symptoms. And there's kind of two ways I want to talk about that. So because it really does go both directions, is that sometimes when people come in, they're describing some symptoms, and I'm saying, hey, what we need to do is look at the fact that these symptoms may be coming from anxiety, that anxiety might be the thing that's really driving these symptoms. And also, by the same token, some people might come in and be feeling anxious. And really what I'm going to say is actually these symptoms, the symptom picture that you have actually points us more towards one of these root causes of anxiety that we'll talk about, like some different physiologic type cause of anxiety. Basically, this list of symptoms is a great list of descriptors for how people feel when their cortisol is high, when their epinephrine and norepinephrine are high. And those are the transmitters that are associated with anxiety. So for some people, they have a condition or something going on in their body that causes those to increase, and then they feel anxiety. And for other people, they have a thought that then makes them respond with an increased level of those things. So what that looks like in sort of day-to-day life is that for some people, they're just sort of going about their day, making their breakfast, and all of a sudden they're just like feeling anxious, and they might be thinking about things that might be the cause of the anxiety. They might be feeling that anxious feeling inside of them. And, like any of these symptoms in this list, they might be feeling their heart racing. They might be feeling like a little sweaty, a little bit nervous. And then they might be searching for reasons why they're feeling like that. And then for someone else, they might sort of be in a situation where, say, they watch their kid at the playground and they start to think about what would happen if their kid got hurt. And that sort of precipitates a whole sort of physiologic response, like that heart racing or that sweatiness or that sort of feeling a little bit faint or lightheaded or difficulty breathing. So, and so a lot of times people, as they start to like notice it, can actually kind of discern that usually it's both and. So for people who kind of tend towards anxiety, they and really for all of us, it can be both and, right? We can have reasons that our body is triggering those responses, and we can have reasons why our thoughts are triggering those responses. So I'm going to first talk about all of the different things that sort of present as anxiety. So when people come into the clinic and say, hey, my main issue is that I'm, having trouble, really focusing or taking on new tasks, or going to visit friends, or going to work because I just get overwhelmed with a feeling of panic or a feeling of anxiety. in my mind, as I'm asking questions, this is sort of the differential that I'm working through when that's people's main symptom. There's a few things I left off of here because they're very rare, but so I'll just kind of, there are other ones. This is not an exhaustive list, but these are just sort of the most common ones that I see people, and can really verify that these were the causes because when we address these issues, then their anxious feelings reduced significantly or completely resolved. So one is low blood sugar. I put this at the top because it is by far the most common. So for a lot of people, they're either eating foods that are very high glycemic, so they're very sugary foods in the morning. So they're having their donut or their Pop-Tart, and then they're feeling very anxious, usually a couple of hours later, because often there's a reactive hypoglycemia where their blood sugar drops, sometimes not until the afternoon. The other thing that I'm just going to point out here with this low blood sugar statement is that I'm seeing it more and more with people with different types of artificial sweeteners. So, and even not even totally artificial, but I should say non-caloric sweeteners, because it doesn't just mean aspartame, it actually means stevia as well. So what happens with stevia is that your body can get a signal as if it's receiving sugar, but then so you produce insulin so that pulls any sugar out of the bloodstream. However, it's not actually sugar. So it's that it takes too much sugar out of the bloodstream, and now you end up with a lower blood sugar. So it basically tricks your body into having a response as if you just ate sugar when you didn't, and then that makes it drop a little bit. So I see quite a few people having responses to both sugar alcohols, which include things like sucralose, which is Splenda, or stevia, or even monk fruit, some of the newer ones as well. So just kind of, if you're a person who kind of tends towards that low blood sugar, it's great to just avoid those non-caloric sweeteners. So if you're eating something sweet, have it be something that contains either fructose, or sucrose, or any of the the like maple syrup, any of those honey, the actual caloric sweeteners, so that your body doesn't get tricked into reacting like that. So that's one of the biggest ones, and we'll talk about how to really address that. And I really think for everybody who has anxiety, one of my treatment, sort of the base of the treatment, is to really regulate blood sugar, because that's the best way to sort of create more of a even keeled kind of feeling, and sort of more of sort of moving through the world with sort of a grounding feeling, is often helps with that, with the low blood sugar. Yep. Do you have a question?
Yeah. So I'm seeing a lot of ads on Instagram, Facebook, etc., for these glucose monitors that you just kind of shove into your arm, and then they tell you in real time what's happening on your phone or whatever.
Mm-hmm.
Those
are fantastic.
Do you recommend those if someone's having an issue?
Yep, I highly, highly recommend those. So you can go two different directions with them. So what they are is it's called a continuous glucose monitor. So it gives you this really direct feedback about what your blood sugar is doing. There's a couple of reasons that I like them. One is that you get a really direct feedback about what foods cause what changes in your blood sugar. So so that you can, and actually really, this is a very person to person sort of thing. So we have things like the glycemic index and different ways of understanding that are supposedly more kind of broad based, but and apply to everyone. But what I find clinically is that some people have a really strong response to pasta, in terms of their blood sugar going really up and then crashing. But potatoes, they do just fine, but and I've seen some people with the complete opposite, or bananas, some people do just fine with them, and other people really throws them off. So what that does is does a couple of things. One is it really lets people sort of associate foods with ups and downs of their blood sugar, so they can really kind of hone it in how to keep that really nice and stable. The other thing is that it helps people associate what they're feeling with their blood sugar. So very often people don't have to do it for very long. So 2 months, maybe some, 1 to 3 months will give people quite a lot of information, so that they actually start to notice oh, wow, every time I feel, and for some people it's overwhelmed, for some people it's sleepy, for some people it's panicky, for other people it's spacey, lots of different things. But you really start to be able to correlate those two values, that how am I feeling with the numbers. And then what happens is after that 2 to 3 months, then you don't really need the continuous glucose monitor anymore, because you're oh wait, that's how I feel when my blood sugar is dropping. So you can kind of know what's happening. And go ahead.
Is there a specific brand or product that
there's
that you would recommend?
There's two different directions to go. One is to go with the NutriSense is a great company that does it actually gives you a lot of coaching. So you wear the continuous glucose monitor, you do your food tracking, and then you have a dietitian that will work with you and help you identify what foods are doing what. And that's really nice because you get to like get that direct feedback. And so that's actually a great way to do it. That one you pay monthly, and it's pretty pricey. I think it's like maybe like $200 a month actually. But part of the reason it's so pricey is that the sensors themselves are extremely expensive. So if you're paying outside of insurance, it's about $100 a month for the sensors. So the other direction you can go is to go to get a Freestyle Libre. I like that one better than the Dexcom one. And you can get that continuous glucose monitor, and then you can get the sensors. I'm actually thinking about maybe having one for the clinic that is a one people can borrow for a month. That's my sort of like part of, at some point I want to have like a gadget library, so that people can use these things, because you get so much out of them in that first month, but then a lot of times you don't really need to keep using them, so anyway, all that to say, that's the brand of the actual one that I recommend. But if the NutriSense one, I think some insurance companies will even pay for it, but it's that's a great one to have lots of support and oversight and just sort of like guidance about how to use the information that you're getting.
Thank you. That's great. I didn't know if they were kind of not helpful, like if they were just something that people were kind of chilling out, or if they were actually like something that's going to work.
Yeah, no, I've met a few people that I've worked with them on those when we haven't really been able to get to their blood sugar by like the normal routes, use those and have it just get dialed in like completely. And that can be both in terms of like for people who are training and like want to really up their training and, feel stronger. They also help for some people who, both anxiety and depression can actually respond quite a bit to blood sugar regulation and, everything, and even like sleep disturbances. I mean, there's so many different components to what we see with low blood sugar, low and high blood sugar. So definitely. And thanks for asking that. I actually I appreciate being able to mention that, because that is a really great tool that's now available. It's a pricey tool, but actually what you get for it in terms of information is really something that will always benefit. You can also, if you wanted to do that, but you don't feel like that is accessible to you to do something like the continuous glucose monitor, you can actually use the good old finger stick, which you can get at a drugstore for about $20, and start to take your blood sugar both in the morning when you wake up, and also if you're having any symptoms of anxiety, and then that will give you some ideas about whether or not you're having some low blood sugars that are contributing. So if you want more information about that, I totally will talk anyone through how to do that with the finger stick. But it's just, you can actually just do it by kind of like taking it at different times and recording how you felt and start to create those correlations. And that's the more financially accessible way to do it, if anyone is looking for that. So caffeine consumption is another thing that often I actually was thinking about it, like I could speak from the eye perspective, just because that's usually like the easiest way to be like the most clear and honest, is that I know for me, sometimes drinking caffeine can make me feel more confident, can make me feel kind of more sort of ready to do whatever I'm about to do. And also caffeine definitely pushes those epinephrine, norepinephrine levels to a place where a lot of times they're excessive. And so for a lot of people, they sort of think that they don't want to not do caffeine because it affects their performance. But then at the same time, the net effect of the caffeine is affecting their performance even more than the lack of caffeine would be. So when people say that to me, like, hey, I can't actually do my job without caffeine, what I say is, okay, let's try replacing caffeine with intensive exercise, even if it's for 5 to 7 minutes, because that gives you that same boost without, you're not going to get the excessive levels with exercise that you can with caffeine very easily. And caffeine is hidden in a lot of different things. So, like people drink kombucha, there's a bunch of caffeine in that. Actually, a lot of like the different drinks and even some supplements, anything that has like the green tea extract or the or actually not, some green tea extract isn't with caffeine, but there's a lot of people put caffeine in a lot of like workout supplements as well. So watch out for caffeine. So cortisol is an interesting one, which we kind of talked about more in like the adrenal class, but just to kind of revisit that. So high cortisol levels can be an effect or a cause of anxiety. So for some people, I can see that they're and sometimes we just never know which is which, in terms of did a person's sort of thoughts or stress level create the high cortisol, or did the high cortisol create that sort of internal milieu of feeling more stressed about things? And I think, again, it's probably both and, because so many times it works that way. So the times that I've definitely seen where people can have high cortisol that causes anxiety, for some people, their hormones can kind of shift in a way that makes them make more cortisol. So sometimes that's with like birth control pills, or with pregnancy, or with sort of the last part of their menstrual cycle, that they can have a shift in their anxiety, and that's partially because of the cortisol levels shifting with the progesterone. So definitely something, when people the time I think about high cortisol the most is when people also tell me that they're feeling quite nauseous in the morning, or if they tell me that their anxiety is really bad in the morning and then gets better by the afternoon. That's also kind of zones me in on the cortisol level. Iron deficiency is another one. Iron deficiency symptoms can be like, wanting to chew ice. Sometimes people getting restless legs at night. Often some paleness, especially if you pull down right here, like underneath the eyelid here, it looks a little bit pale. Those are some of the iron deficiency symptoms. And iron deficiency, actually almost any, it's a stretch to say any, but many different vitamin deficiencies can cause an anxious feeling for people. But iron deficiency is a big one because it causes difficulty getting enough oxygen in. So people will feel this kind of like shortness of breath, kind of sort of a panicky feeling that can go along with that. Hyperthyroidism is one that is where your thyroid gland is overfunctioning, so it just makes too much of the hormone that is really related to metabolism. If people come in and they say that they're having they lost a bunch of weight without eating less, if they're having lots of diarrhea, or if they're having sort of palpitations, like irregular heart rate, those kinds of things, I definitely do want to think about whether or not they have hyperthyroidism. It's a not very common condition, but it's common enough that I see it pretty regularly. So, and then pain can actually cause anxiety. So our response to pain is often to produce more of the epinephrine and norepinephrine. And, that's kind of an adaptive response, like a survival response. And for some people, just the having pain can make their anxiety get worse. Alcohol consumption contributes to anxiety in a few different ways, but both because of its effects on sleep, so it decreases sleep quality, and that contributes to anxiety, but also itself has been linked to it, and nobody really understands exactly the mechanism, but what seems to happen is that alcohol stimulates this GABA pathway, and then once it comes out of your system, then it actually there's not enough of that GABA to help you stay calm. It also induces some dehydration. So kind of if people have like a hangover that is with a lot of anxiety, a lot of times that's a dehydration type of a picture as well. But it also can be that kind of GABA deficiency there. And feel free to stop me if there's anything that y'all have questions about. Marijuana is one that it's an interesting one because I've been kind of watching it, and for a lot of people, they talk about using it for their anxiety. So they actually use it as to treat anxiety. One thing we do have to watch for is that it also can increase anxiety. So it's kind of a back and forth, and it does seem to be dose dependent. So the higher doses increase anxiety, the lower doses can decrease anxiety. And there's been a couple studies showing that CBD is the part of marijuana that actually is more anxiolytic, meaning it decreases anxiety more. And also the little caveat to that is that I see a lot of people using CBD supplements, and I don't have any problem with them except for the ones that you get in the gas station that are questionably sourced. I do find that with CBD, a lot of times it works really well at first, and then it stops being as effective. So people use it for sleep or anxiety, and it's really great, for those things. But I really think of it as being the best use of it is kind of intermittent use, so that you get the most effect from it. Because for whatever reason, I just see it sort of wearing off over time for a lot of people. Sleep apnea is something that can cause anxiety. So when you're sleeping and apnea means you're not breathing well when you're sleeping. So it can be for a variety of different reasons, but the most common one is that there's an obstructive airway, which can be from tonsils. It can be from, sort of having like a broad, wide neck. And it could be from your adenoids being enlarged. It can, so that's that airway obstruction where you're basically the flap kind of just like it doesn't open properly. So you can't breathe all that well at night. And whenever that happens, your body produces a lot of stress hormones to try to get you to wake up and breathe again. And so it does it in a few different ways. So one is in terms of sleep apnea or difficulty sleeping in for any reason can increase the cortisol levels. Other types of difficulty sleeping can be caused by increased cortisol levels, but really the sleep apnea can make you have more of those transmitters going around that are the stress transmitters and can create quite a bit of anxiety. I had one patient who that was really his only presentation of sleep apnea. And a lot of times one of the sleep apnea has kind of like needs a new PR campaign because or not PR, but a new like PSA campaign, because a lot of people associate sleep apnea only with people who are overweight or obese. And that's actually just not true, that there's quite a few people who are who don't fit that profile, but that have sleep apnea. So definitely one that I think about in a lot of circumstances, including anxiety that doesn't, where especially where a person wakes up feeling very anxious. All right. Magnesium deficiency. So this one has a couple of different ways to talk about. So magnesium, we're going to kind of swing back around to talk about magnesium. So you can have a frank magnesium deficiency because most of the standard American diet is a very magnesium deficient diet. So it doesn't have a whole lot of magnesium in it to begin with. And then whenever we eat sugary foods, or whenever we drink coffee, or whenever we drink alcohol, we lose some magnesium as well. So basically, if you start with not enough coming in, and then you have different things that are pulling from that magnesium, also getting stressed actually can decrease the magnesium level a little bit. So that's where you can have a deficiency. And then the other thing that we're going to talk about when we talk about magnesium is about that for some people, there's an enzyme that is there to break down, one of its jobs is to break down the epinephrine and norepinephrine. And magnesium supports that enzyme. So basically what it does is it helps clear out some of those extra excitatory, like those extra nervous making transmitters, so that so that can be supportive for people, especially people who have that enzyme mutation. So let's see, I'm actually just going to make sure everybody's on mute so that, but everybody can unmute whenever you'd like to, just because I don't want you to end up having to you see yourself popping up on the screen all the time with the recording. So dehydration is another big one. Many people are dehydrated, especially this time of year. I see it a lot. A lot of people's labs tell me that they're dehydrated, even when I didn't sort of see any indications of that. So really, when we talk about dehydration, it's not just about drinking water. It's about eating lots of, fruits that have lots of water in them. Making sure to, drink even extra when it's a hot or humid day. Another thing, just a note about dehydration, is a lot of times too, when I see people who, there's a lot of reasons for this, but see people who getting progressively more anxious through the decades. So they're like, oh, I'm in my 60s and all of a sudden I'm sort of feeling more anxious than I did in the past. I definitely, when that's happening, I think a lot about blood sugar and also dehydration, because it becomes much more easy to become dehydrated when people, moving from 50 to 60 to 70 to 80, each of those jumps makes it much more easy to become dehydrated. So just to keep that in mind, that a lot of times even we just have to work a little bit more with electrolytes and making sure people are getting enough protein to make sure that they're sufficiently hydrated, because both of those things are important to be able to hold the water as much as drinking the water. Premenstrual syndrome, definitely hormone-related anxiety is a huge thing that I work with a lot, and there is that that video on premenstrual syndrome if you want to like learn more about that. Very often the most common time that it happens is right in the last part of the cycle, right before the period, a person's period. And a lot of times I'm using high magnesium foods during that time, or helping them support their progesterone production, because progesterone also has a calming effect. Often when it is premenstrual syndrome related anxiety, it's because their progesterone kind of drops off too quickly. And then I mentioned about artificial sweeteners, that kind of relates back to that low blood sugar. And undiagnosed ADHD, one of the things that there's a couple of ways that I've seen that play out in terms of people really presenting with anxiety when we actually discover later that it's really like an ADHD. One of the things is that people with a brain that's more of I like to think of it as like a hunter-gatherer brain. They actually sort of require a certain amount of stress in order to be able to get things done. So they sort of, in order to make enough dopamine to initiate a task and complete a task, they actually have to have a little bit of stress around it. So tend to have a little bit more sort of like, really it's a coping strategy to sort of feel more stressed about a project that they might be working on, or to be more to kind of like stir up a little bit of that so that they can get themselves to actually finish the task. I mean, one of the classic ways that I see that playing out in terms of ADHD and anxiety is that procrastination is a huge coping strategy for people with ADHD, because that creates enough stress that they finally are able to sit down and get it done and focus. So really, sometimes it's really about, trying to get enough, the striving to get enough dopamine means kind of like stirring up a little bit of extra chaos or a little bit of extra stress in order to get that dopamine level to an appropriate level so that they can kind of do what they need to do. And again, we'll talk about some other ways to get that dopamine level up so that stress and anxiety doesn't have to be as much of that picture there. So any question about all of those, or about kind of like those root causes there?
Yeah, just one question in terms of ideal amount of water to take in a day. What do you recommend?
So it depends on how much physical activity you're going to be having, but the 8 glasses is a great place to start. So if you're getting less than 8 glasses, it's just really good to aim for that 8 glasses. If you're getting some physical activity, or if it's hot, add an extra, I think it's 24 ounces for every half hour of physical activity that you're doing that, is the any kind of higher intensity or sweating kind of physical activity. Some people use this formula of half your body weight in ounces. So, if a person, weighs 200 pounds, they would drink 100 ounces of water per day. And I think that's a pretty good, good formula to use for the most part. A lot of times when people increase their water intake, they notice that they're urinating all the time. It does take a little bit to adjust to a higher level of water intake. And if dehydration is one of the things that we're looking at in terms of a cause or a contributing factor to anxiety, one of my favorite things are these little, it's called a ULA hydration reminder, and it's just like a little strap that goes around your water bottle, and it blinks a light if you haven't had a drink of water in a half an hour. It's a good little, like, all these little things that just sort of give us the little like, oh yeah, right. Like it's a good sort of habit trainer is really, and a lot of times people just use them for a little while and then they kind of get more accustomed to drinking more water. So yeah, anything else?
I'm interested in learning more about that hunter-gatherer brain, but
yeah. So I should do a class on that, because that's really about it's a great sort of framework for this idea of like, ADD, is a different kind of concept of ADD where people are either farmers, where they kind of really thrive in environments where things are very routine and predictable. And then there's the hunter-gatherer brain actually really struggles in environments where things are routine and predictable, and really thrives in times when there's lots of like change and challenge and, engagement, and more kind of like sort of, responsive to things that are happening. The book, if you want to read the book on that one, it's that kind of started that whole framework. It's Tom Hartman, The Edison Gene is what it's called. it's kind of it's a little bit woo. It has some woo parts to it actually in the beginning, but it's a really great kind of like laying out of a framework of thinking about ADD in a different kind of a way.
Okay.
Yeah. So, really in terms of when we think about treatment, obviously, we're treating based on those causes when those come up, but then there's also some things that we do that are more what I think about as being kind of like rescue treatments, or just sort of like, okay, things that you can have in your back pocket for when you're feeling anxious, or kind of like just general treatment sort of overviews. I really think about therapy being important, even when we're identifying that the cause of anxiety is physiologic, because a lot of times there's like thought habits that go along with that physiology. So if you're constantly running this like sort of, high stress sort of, epinephrine, norepinephrine kind of thing, and even if it's because of low blood sugar, a lot of times people develop sort of a habit around, having very stressful, high stress thoughts and high anxiety thoughts. Like that includes like, catastrophizing, which is kind of that thinking about things as like the worst possible outcomes. Really that kind of foreboding joy. So like, even if they're feeling joyful, feeling like there's something else is going to happen that's going to be bad. Or that worry, sort of like thinking about other people or situations, or trying to like figure things out all the time. And anticipatory stress. I mean, there's so many on this list, but anticipatory stress about an event that's going to happen soon. So really, I think therapy is so great because it gives people, gives us all, I do it too, that the skills to kind of work through those moments, and to be in those moments, and to sort of like accompany ourselves through those moments. That's really the way I think about it. Exercise is kind of the next one that is absolutely essential when we're thinking about anxiety, because of the way that it helps to balance out all those neurotransmitters. It sort of, brings in the endorphins, which actually give us more of like a general like life is lovely kind of feeling. And specifically walking has been shown to decrease cortisol levels. So that's a great way to just sort of start there with just walking. And even there's been all these studies. I sort of like laugh at like how hard it is to do these studies, but how much we all kind of know that they don't really need to be done. But they do all these studies about like people looking at, trees or at the water, or, things like that. And then look at like, how does that affect their stress level and their, and their self-reported anxiety. And it always helps. But, but again, it's one of those things that none of the studies are done very well, but like, we kind of also all know is true. So even more like walking outdoors, or walking with a friend, or, having those additive, stress and anxiety reducing qualities as well. Even, sometimes people, the breathing that you do when you're walking is also helpful. I find, like for some people, like a lot of people with anxiety get told like, oh, here, do these breathing exercises. What I actually find is sometimes that those for some people can make it feel a little bit worse, because then they're sort of like sitting there trying to do the breathing exercise, and they're thinking like, why can't I do this? This is not work. Like kind of like there's sort of like a thing there, a thought process that's happening there that actually kind of almost they feel more anxious trying to do them. But when you're doing something like walking, and you just naturally have to breathe a little bit deeper, that can stimulate the vagus nerve, which then can also have a calming effect as well. Some people notice that the high intensity exercise routines are what really help them the most, but other people, it's more of the gentle, like walking, yoga kind of things that, and I think that's just really one to play with and to try different things out. And you can even, if you want to, you can even do something like just sort of a check-in, like a checklist, like the Beck anxiety inventory, and just sort of be like, how many am I feeling before and after I have do this thing, whether it's walking or yoga or a high intensity workout. And just even for gathering your own information about how that affects you. A lot of times you don't need to do that because it's pretty clear what's happening there. So again, that kind of blood sugar stabilization, eating just generally, like the general recommendation to regulate your blood sugar is eat foods that are more high in fats and proteins, healthy fats, like the omega-3 fatty acids and things like that, versus the saturated meat-based fats and things. To really stabilize blood sugars throughout the day, so that you don't get the ups and the downs that happen that both can create anxious feelings. caffeine and other stimulants, as much as possible, like what I always say is these kinds of things, it's worth doing a little experiment. So, saying like, okay, I'm going to take, 2 weeks of, some people are like, okay, I smoke marijuana on the weekends and, that's it. And so I don't think that's affecting me during the week, but actually sometimes it can have kind of a lasting effect. So, if you're curious about that, just taking 2 weeks where you don't do it and see how you feel. And then, bringing it back in and see how you feel. It's kind of a good way to sort of assess what's happening there. Alcohol is also very much so like that as well. Something that's worth giving a little test there. There's also a lot of people talk about, it's just hard to be a person who, like all your friends are having a drink and you kind of want to have one, and you like the relaxing feeling of it. There's actually a lot of really great sort of like non-alcoholic beverages that are coming out. One of them I really like is the Sunwink. You can get it at Fiddleheads. It has like herbs in it that are calming. So it has like ashwagandha and lemon balm and, some of the things that we're going to talk about, but so it has that calming effect, but it's not alcoholic. There's no like hangover the next day. And it sort of like feels like you're drinking a cocktail, it has that feel. Go ahead. Mm-hmm.
If I'm already taking an ashwagandha supplement, is there danger in having a beverage that has more ashwagandha?
Nope. Good one. Yeah, definitely. So that it is okay to take that because it's still pretty in the beverage. It's going to be a pretty low dose. So it's going to be kind of like just a drop in the bucket compared to what we do with supplements.
Yeah. I've also, the last couple of weeks, I got a couple 6-packs of Athletic Brewing Company, only does non-alcoholic. Mm-hmm. And it's not beer, but it's a decent substitute.
Yep. Right. So, yeah. And it's almost like it can create like a little bit of that Pavlovian response of like, you're like, oh, I'm so relaxed. I mean, actually, also it's going to have hops in it, which hops are really actually very calming. So, some of those non-alcoholic beers are getting pretty decent. Yeah. Athletic is good. And there's another one that was called like Emissions or not Emissions, but Emission or something that was really good. That was a non-alcoholic one. But yeah, there's definitely like so many options out there these days that are, really great for still having that calming effect, but then also at the same time, not necessarily having all of the negative side effects of the alcohol. Yeah. All right. And then, in journaling, there's been a lot of studies about journaling and how effective journaling is for helping to reduce anxiety. What I really think about it is that it can be really grounding. Like sometimes even writing about the things that you're thinking about in an anxious state. And this is not necessarily for like a panic attack. I wouldn't necessarily tell somebody to journal during a panic attack, but more like just sort of like if they're noticing that they're having lots of repetitive thoughts or worried thoughts or anxious thoughts. Sometimes even just like sitting down, writing them down and then looking at them and sort of like, responding to them with that, internal wise voice can be really great to be like grounding with yourself. There are some, sometimes people just free journal, but also there are things like this, a prompt journal that, this is called Create Your Own Calm by Miralee Patel. So I've heard some people who really like that one. It has like little questions and answer sections that sort of help like people, help you through a process of sort of identifying ways that you can support yourself in sort of balancing your neurotransmitters really. So theanine is a great one. I really like it because there's no dependency, there's no sort of like negative side effect, but it is working on that same pathway as the benzodiazepines. So which are like, Xanax and Klonopin. Xanax and Klonopin, work really well for anxiety and also they have this pretty rough side effect of becoming very easy to become dependent on and also really hard to get off of. And I actually find it's really one of the most effective things about something like a Xanax or Klonopin is just people having it in their pocket and knowing that it's there is actually can be really helpful because then it sort of takes away some of the anxiety about the anxiety. So like, because a lot of times that sort of feeling of like, what would happen if I had a panic attack in this situation or in this situation? If, sometimes having these rescue things, whether it's an L-theanine or a medication that just like to know that you know what to do, if, you would have something you could do in that situation. But
what is
yeah,
L-theanine, what is that? Is that different than what's in the Neuromag supplement?
Yeah, it is different than Neuromag. Yeah, yeah. It's so a lot of times it's a combination. So there's sometimes it's in Zen as a combination of L-theanine and GABA, but then there's also like chewable L-theanine, and it's so it can kind of those two can go together. We don't want to ever combine L-theanine with a benzodiazepine. So if anyone's taking a benzodiazepine, I don't usually add those two together. But it works pretty quickly. Okay. And it's a good, it's a good one. It's a precursor to GABA, so it basically feeds that GABA pathway. So yeah, I think the two most common ways that I prescribe L-theanine is in that formula called Zen, and then also in the there's these gummies that I use, or these little chewable tablets too.
So it's instead of a benzo, instead of an Ativan or something.
Yeah.
Do people find that it works as well?
Not as well, like there's nothing that's quite as strong as that, but it works quite well, and it is something that it does, I find that people can use it, especially if they kind of catch like a panic attack before it's kind of in its full blown zone, the early one, that can be a really good.
Not to get too specific, but when I take benzo, I take Ativan, I take an incredibly low dose, like 1/8 of a milligram.
Totally, yeah.
So it's possible that it would be as strong, because I'm afraid of developing an addiction or something, because it's kind of runs in the family.
Yeah, totally, absolutely.
It might actually be more efficient.
For sure, yeah, definitely, yeah, and a little easier too. So yeah, I mean, definitely, that's something we should reach out to me. We'll talk about that as an option. Definitely a good, could be really good. And definitely, especially with low doses like that, we have a little bit more wiggle room in terms of that too. So
right,
yeah. So yeah, the L-theanine is great. It doesn't have like really any major negative side effects. So I do think that it's one of those ones that sort of generally recognized as safe. It's basically like a food type of a level kind of a thing. It's really it's an amino acid. So that's where I feel comfortable talking about it here. But if just to be really clear, if anybody was ever like trying to get off of benzodiazepines or was ever in a situation, in something like that, I would never want somebody to be doing that without sort of help and oversight, and just to know that anything talking to me about anything like that, I'm never going to have a judgment about anything like that. Just more, I would come in with support, because coming off of benzodiazepines can get pretty dicey sometimes. So if this is mostly for people who are like listening to the recording, if that's the situation, just let me know and we can work on it. Lemon balm. Lemon balm is an herb that is a good one for drinking tea. It's a good tea drinking one. Sometimes people just kind of drink it throughout the day. It lowers cortisol levels. And for some people, it helps with their focus. And specifically, they've been done studies about it helping with like word recall as well. I like when I was trying to remember word recall, I was like, wait, word recall? But yeah, so it's quite helpful with that. And at the time that I use it the most is when people have like a premenstrual or a menopausal anxiety, because it's really helpful in those times when it's more hormonal as well. The caution about lemon balm is that it can have some effects on the thyroid. So we want to be sort of cautious about it, people, especially if they're hypothyroid, so meaning their thyroid runs a little bit slow. And also it could make some, if you take medications that for sleep, it could make those a little bit more potent. So we always want to watch about it if you're taking medicines for sleep as well. So passion flower is another great herb that's been used for a long time. It's even something that is okay for kids. Sometimes I even have people, put it in the bathtub for kids to help with like kind of calming down for bedtime. That and some Epsom salts and, lemon balm, passion flower, and Epsom salts, and actually even some catnip in a bathtub with is a really great one for kids who have a lot of trouble, just sort of that wind down process. That there is the formula called Traditional Medicinals Organic Nighty Night Tea, which I really like. It has passion flower, and then it also has it does have some lemon balm and some chamomile and a couple of other ones, but it does not have valerian in it, which is good. And you can actually that traditional medicinals organic nighty night, you could drink it throughout the day because it doesn't have a particularly sedative effect. It just is more of an anxiolytic effect. So anxiolytic means like, reducing anxious feelings, whereas sedative means makes you feel sleepy. And a lot of the things that are used to reduce anxious feelings are actually can make you feel sleepy, especially in higher doses. But that one tea right there, that passion flower and lemon balm both don't have a whole lot of sedative properties. They're more about anxiolytic. Because I find that a lot of people, have medicate or have different sort of options for things that are sedatives, but that sort of like what can I use during the day is often something that comes up as wanting treatment options for. And then good old magnesium, it supports that enzyme that we talked about that helps get rid of the extra epinephrine and norepinephrine. Often if people are magnesium deficient, they have more of the symptoms of like the cramps in their legs, or they can often have a pretty intense cravings for chocolate. And also though, if people, it can be used therapeutically, even if people do not have a magnesium deficiency, to help to support that enzyme that breaks down that epinephrine and norepinephrine. So that COMT enzyme. So yeah, and then the foods that are really good for, that are high in magnesium, is a great way to get a little extra magnesium is nuts and seeds. So especially almonds are really high magnesium. Leafy greens and beans are your go-tos for, and a lot of whole grains actually also have quite a bit of magnesium in that as well. So, and then some resources, just in terms of, like sort of places to go to sort of develop some of the, some skill, some of the, but I was talking about therapy, also there's other places that you can kind of get more of those sort of resources. Meditation is a big one, and it's been studied quite a bit for treatment of anxiety and changing like the anxiety, all of the symptoms of anxiety, and changing people's response to even their ability to sort of like take it when they're kind of moving towards panic, and then they can kind of bring it back with meditation. Really, meditation is that training yourself to be able to shift your focus, so be able to kind of move your thoughts in different directions. And so the ones that I like the most, the apps for that are the Headspace, that's a great one for just kind of training meditation. 10% Happier has a lot of neat like programs, and they have specific programs that are for anxiety, where they have like multiple sessions of like talking about anxiety. Some of them you have to pay for, but some of them are free. So there's also the Calm app, which has lots of different meditations. Again, I really encourage people to pay attention to which types of meditations are actually helpful to them, so which ones they actually feel more calm after. I do find that sometimes when people are in a heightened state, that often a meditation where there's lots of like space and quiet can be actually make it worse, because it sort of gives more space for those thoughts to spin. Whereas something like going for a walk, or moving your body, or even a meditation that does a lot more talking, like is more of a guided meditation that's more body-based, guided to kind of like relax your muscles kind of a thing. That those can be a little bit better. So just sort of like paying close attention to whether or not this is actually helpful for you particularly is an important thing to do. And then Shine is an app that's really good as well. So I encourage people to just kind of look through those and see which one appeals to them the most, and try out a few different meditations or and then there's that Create Your Own Calm Journal that I mentioned before, which is like all the prompts and everything. There you can look around. There's like a bunch of different ones like that. That just happened to be one that people have reported back that was really helpful. And then there's this meditation called Facing Fear with Compassion. And I realized that anxiety and fear are very different, but also this particular, fear is a component of anxiety, but it's not, we can't say, I'm not saying that those two things are the same. This meditation is a meditation that you can do as a regular meditation, but she also kind of basically outlines like a really great way of journaling that helps to address those moments when our thoughts are just sort of like spinning, and also when we're trying to kind of find solutions for things that we can't really solve, and how to kind of turn that back around into more of a gentle, peaceful place. So yeah, that's all the things that I really think about when I think about treating anxiety. Is there any other like questions or any specific things about that? No? All righty. Well then, it's great to see you, and thank you both for coming, and please don't hesitate to reach out if you do have any questions about anything we talked about here today. All right.
Thank you. I got a lot of good
Thank you.
stuff out of
The
this.
recording too.
Yeah, same here.
Mhm.
Have a good afternoon.
You too. All right. Take care.
Bye-bye.
Bye-bye.
Bye.